Okay, so the next bit then will be actually taking these units through and seeing how they fit in the various surgeries. So this is going to be a little bit Heath Robinson, but I'll do my best to actually show you the placement of these units. This is in my surgery. As you'll be able to see, that's placed by the side of my chair. The issue with this is I've got a little bit of a base down here, and to get that forwards like so and tuck that in a little closer, then the pipe doesn't quite reach. So I've got this issue with the floppiness. I can bring that forwards and make that as close as possible here. Of course, that comes out like that, and then trying to get that to stay up. Of course, we're a significant distance from the headrest, so what I did then was I pulled the spittoon bolt forwards a little bit and moved this forwards into that gap. I'm presuming that something could be done. There could be a mod in relation to that bamboo arm. That's actually a little bit more difficult to place, but not totally unworkable. You could actually make that work in here. Okay, so this is the positioning in my surgery, in the bigger surgery. We've got the DentalAir by the side of the chair. That can actually tuck almost right in underneath there, with obviously taking care that the actual base unit doesn't get in the way of the auto return on the chair. The top comes up nicely over the patient's face, like so. If anything is going to be a challenge in terms of positioning a DentalAir or a VacStation for that matter, both units are roughly the same size in terms of the base unit. It'll be this room. We've got sort of a narrow walkway here with the chair, and then the delivery unit to the side there. And I was very worried about the unit being down here, that it would prevent the walkway through for the nurse, but I just come on through here, and even I can actually get through there quite easily. So you know, that's actually pretty good. We've got this Rigiflex arm which can be pulled across and then pulled up, so it's out of the way. Most of the ton spittoons at the moment are going to be out of use. This is going to be very practical in here, and yeah, I mean, you know, that's really quite a compact placement there. You'd imagine that with the VacStation, because it's about the same size as the DentalAir, I've popped it down here, that there wouldn't really be a problem. But if you remember, I had to actually move this out, and the issue then comes with the fact that this now closes off the walkway in this surgery, or makes it rather awkward, and there's not much of a gap through here. So there is a little bit of an issue there in terms of pulling that forward. So let me just set this down. Right, so as you can see, if I do pull this forward into a position there, it means then the nurse has to come around the back. If I put the chair down into a position where this will actually go, right, okay, well that works quite well, but of course if you've got a limited walkway where you need the base of this unit to be relatively close to the headrest, apart from this creaky noise, you know, then it can have limitations, and I think this is the major problem with this unit. Okay, so we'll be moving on to the next room now, and we'll be placing this in a into a different environment. Okay, there we go. Right, I thought I'd just show you moving between the surgeries. Got the VacStation here. As I said, it's only got wheels on one end. So that's what I see. So I lift this up, and we can wheel that along like that. A little bit awkward. So in the main, I tend to pick this up. It's a little bit unwieldy arm, but it's doable. Right, okay guys, so now it's the turn of the DentalAir. I've got the unit down here. Obviously it is completely on wheels, so we can roll this around. I've got the Rigiflex arm there, which I can just use as a sort of a handle to push, and we can wheel that down down the corridor. Right, okay, so coming into my third surgery with the DentalAir. In this room, the patient entry is from the right-hand side here, so the spittoon has to be moved over, and then the patient gets in like so. Obviously that means that we can't place the DentalAir or the VacStation in this area here, and on this side with the delivery arm swinging in and out like so, it makes it challenging to put it here. The ideal position, of course, is at the base of the chair there, but of course the reach at the moment simply isn't sufficient. So if it was at the foot of the chair like this, in there, and if it reached, which it doesn't, so it's in the park position at the moment, swing that across, bring that down like so, and of course we're well short. As it stands, what I'll do then is I'll just put it into the place where this is going to be hopefully workable as it is. Okay, so here we have it. This is now at a height where that could actually go over the patient's face. So shortly, obviously, this will have an extension tube, so it can go down there, which is where I would really want it. Right, okay, so it's the turn of the VacStation now. Let's just wheel that in. We know it's going to go over here. I've tried the DentalAir, it's roughly the same size box, so all being well, that should be good. So I'll just position that now. And I already know from having put the DentalAir in, this has got to come quite close to the front to allow the delivery unit arm to come in around here like so. So placement of the VacStation in this instance, haven't plugged it in of course, but here if you bring that far enough forwards with this sort of an arrangement like this, I suppose that doesn't get in the way, I suppose. Yeah, that noise. Okay, well that's the positioning of all the units in different surgery environments. Hopefully just a quick one, bit of an update. I have received just recently this arm. Now, this is from Vodex UK. Apparently this is the very first one in the world. It is a prototype model, but having spoken to them in relation to the issue in relation to putting this at the bottom of the chair, they've come up with this, and this apparently is going to be developed and will be a production add-on to the DentalAir. So what I'm going to do is to just pop this into place, and I'll hopefully get this so that you can see. A few little adapters here. Now one thing just point out here is that this is also now telescopic. So that actually moves up and down like so, and then that fits onto the end of this arm here. Afraid I'm a little bit OCD with these things being straight. I don't know, that's crazy, isn't it? Because that you could spend days doing that. Okay, so that's on properly in there. Just the bottom of the chair. It's like, oh, I mean, look at that. I mean, I suppose that's about the maximum reach. So, yeah. And the unit's still stable, and that can come up there. I know my chair is around about 2 meters long, so got over 2 meters worth of reach here, so probably 2 meters 10, 2 meters 20 in total. For my situation here, I just need to pull this back a bit. And there we are. There we have it. So we have the extension arm for the DentalAir. That means that without the extension arm we can go here or here. With the extension arm we can go out the bottom. Of course it's telescopic, so you know it's going to fit most chairs. Okay, well this is really very, it makes this so usable to be able to place this in any position around the chair, and this really works, and the fact that that's telescopic as well makes that a really useful add-on, so very excited about that. I'm keeping this one in here like this, and yeah, I mean this will be ready for us to go on Monday, so a good clean down first of course, off to do a few other videos. So until the next one, thank you very much for watching.